Hello everyone, this is Dr. Chen Guo from Taipei, Taiwan. Our topic today is the inhibition and activation of TMEM16A calcium-activated chloride channels on the smooth muscle tissue in metabolic syndrome-induced overactive bladder and acontractile detrusor. So this is our aims of study. Overactive bladder OAB is a symptom complex that may have many underlying contributing urological pathologies, among which metabolic syndrome (METS) is a known risk factor. Current pharmacological treatment for OAB includes oral antimuscarinics and beta-3 agonists. However, there exist some patients having poor results and needing new treatment options. The established cause of underactive bladder include neurogenic, myogenic, aging, and medication side effects. Currently, the pharmacotherapy for acontractile detrusor (AD) is still disappointing. During the past years, our studies have linked chloride channel to OAB, significantly increased molecular expression of CLC-3 and CLCA4 chloride channels on bladder smooth muscle has been disclosed using a cyclophosphamide CYP-induced rat OAB model. Increased voiding frequency and non-voiding contractions in CYP-induced OAB rat could be ameliorated by intravesical instillation of chloride channel blockers, implying the potential therapeutic effect of calcium-activated chloride channel blockers (CACC) on OAB. TMEM16A was recently identified as a CACC. Evidence has also been reported for TMEM16A involvement in intestinal and vascular smooth muscle contraction. Specific TMEM16A channel blockers and activators have also been developed. However, the role of TMEM16A on bladder smooth muscle has not been elucidated. We therefore implement a fructose feeding rat (FFR) model of metabolic syndrome to investigate the effect of inhibition or activation of TMEM16A CaCC on bladder smooth muscle tissue between normal metabolic syndrome-induced OAB and AD in rats. So at month 6, continuous infusion cystometry (CMG) was performed. FFRs were categorized into 3 groups: the normal detrusor function (NDF) group, OAB group, and AD group, based on the results of CMG. And then the urinary bladder was harvested for organ bath isometric tension experiments, which involved 2 groups. The first one is inhibitory concentration response curve (CRC) of traditional chloride channel blockers, which is NFA, and TMEM16A blockers, which include T16INHA01 and MONA. MONNA on carbacyl CCH-induced tonic contraction in control NDF and OAB rats. And the other groups is CRC of TMEM16A activator, which is EACT, induced tonic contraction in control NDF and AD rats. So the results of inhibitory CRC and IC50 for TMEM16A blockers and CRC for TMEM16A activator among control NDF OAB and control NDF AD groups were compared below. So you can see here that here shows the representative traces of continuous infusion CMG in control NDF OAB and AD rats. And the table proves the METS status of rats in the OAB and AD groups. The CCH-induced contraction could be inhibited by pretreatment of NFA in a concentration-dependent manner in control NDF and OAB groups. Here shows the inhibitory CRC of NFA on CCH-induced contraction. This slide shows the inhibitory CRC of T16INHA01 on CCH-induced contraction. And this slide shows the inhibitory CRC of MONA on CCH-induced contraction. Interestingly, there was a significant greater inhibition of tension for NFA, T16INHA01, and MONA in OAB group than in control group. The IC50 of NFA, T16INHA01, and MONA in the 3 groups are shown in the table. And the inhibitory effect of TMEM16A blockers include including T16INHA01 and MONA on CCH-induced contraction, are more potent than those of traditional chloride channel blocker, which is NFA. An E-act could induce tonic contraction on isolated rat detrusor in control NDF and AD groups. The contractility increased as the concentration of E-act increased. So here's the conclusions. The results show the pre-treatment of traditional chloride channel blockers, which is NFA or TMEM16A blockers, including T16INHA01 and MONA, could inhibit the CCH-induced tonic contraction in bladder smooth muscle tissue of control NDF and OAB rats with metabolic syndrome. The inhibition effects are more potent using TMEM16A blockers than traditional chloride channel blockers. The detrusor contractility in OAB group was more susceptible to inhibition of chloride channel blockers than that in control group. Treatment of TMEM16A activator like E-act could trigger the tonic contraction of bladder smooth muscle tissue in control NDF and AD rats in a concentration-dependent manner. So taking these results together, there may be an important role of TMEM16A CaCC on bladder smooth muscle in metabolic syndrome-induced OAB and AD rats. Therefore, the TMEM16A blockers may provide novel therapeutic agents for OAB and TMEM16A activators for AD respectively. So thank you for your attention.